Today, we're going to talk about effective communication with a focus on how to have those difficult conversations with parents about their children's development milestones. The Federation for Children with Special Needs promotes quality education, parent participation, and access to quality healthcare services for all children, especially those with disabilities. The Federation is the Massachusetts Parent Training and Information Center, founded by the U.S. Department of Education under IDEA. The purpose of the BTIC is to help parents learn about their rights and how to use them, learn how to communicate effectively with the school personnel, participate in school decision-making, and learn about their children's disability and educational needs. The ultimate goal is to help parents obtain better outcomes for their children. Agenda. Today, we're going to talk about what is effective communication, how to have an effective verbal communication, importance of nonverbal communication, and how to communicate effectively with families about their children's development. So we're going to start about talking about the different methods of communication. So there is verbal communication, that is what we speak. Nonverbal communication, we talk about like the body language, and writing communications, emails, and letters. In this presentation, we are only going to talk about verbal and nonverbal communication. But let's start with what is effective communication. Effective communication is the process of exchanging ideas, thoughts, opinions, knowledge, and data so that the message is received and understood with clarity and purpose. When we communicate effectively, both the sender and receiver are satisfied with what we're saying. In order for a communication to be effective, it needs to be clear, choose word carefully, use grammar correctly, avoid jargon, use technical terms with moderation, correct, make sure that your message is accurate, complete, support your idea with additional content. And for this, we're going to use the developmental milestones. That is how we're going to make sure that our communication with families are going to be complete. That additional information, right? Concise, eliminate unnecessary words to get to the point quickly. A compassion, be aware of the impact of your communication. And this is really important, especially when we are talking with parents about their kids, right? Like we need to make sure that we're gonna be compassionate, that we are understood how they are feeling. Why effective communication is important? Improve the way we work with parents for the benefit of their children, encourage mutual respect, disseminate what is happening in the school, detect and address problem early, and charge concerns. So what may happen if effective communication is missing? May not receive necessary information. You may not know what to do to help the child. And I feel this too got really correlate in the way that, for example, a parent is doing something at work that is working for them at work, and you don't know what they are doing. Or you're doing something at the school that is working for you at the school, and parent doesn't know how to apply it at home. Or maybe both, like you or the parent are doing something totally different, and the child can be a little bit confused, right? So if there is no that communication between you and the parent, it's not going to be that like the child is not going to receive like the same message, right? May not learn about problems until they become more complex. So how many times have you had like a big problem that you just escalated because you didn't communicate on time, because you didn't express your feelings, because you didn't have that conversation at the right moment? May decrease trust between the parties, and this is really important, especially because we are talking about kids, right? The most important for parents are their kids. And just building trust is, you build the trust in the way that you communicate. And you or the parent may feel frustrated. Factors that include that it can influence the effect of communication in a meeting. So we're talking about different perspectives. Maybe you or the parent have a different perspective of the situation. Denial. So when a parent is receiving a diagnosis for child, they go for a like grieving process. They're grieving the idea of have that healthy little child. And now in that grieving process, they also go through the process of denial. So it is how we can detect this and how we can help this parent to go through this process so we can make sure that the child is receiving the services that they needs. Lack of experience or lack of information, educational level. Also really important, the cultural, the ethnic background, the language. Maybe they don't really understand what we are saying. Maybe the parent also have disability issue. So that is a factor that also can influence in if we are already having that effective communication. Not speaking with familiar terms, especially when we're talking in education, in health. There are so many terms that they are really difficult to understand. Also, so many acronyms. So making sure that the parents have all the information and they are really understand. So nonverbal communication is a huge part of the way we communicate as humans. So for example, the facial expression. The human face is extremely expressive, able to express countless emotion without saying a word. And unlike some other forms of nonverbal communication, facial expression are universal. You know if someone is happy, angry, sad, fear, just looking at their face. The, the body movement of postures. So we should be aware of how we are position ourselves, how our body language is talking. Like we want to like make sure that we look confident, right? Gestures are different from the facial expression because they have different meanings in different cultures. So maybe the way that we're moving our hands, that it is different for a culture than another one. So we have to be aware with all the movements that we do with our bodies at the moment that we're talking with parents, because it changed with the different cultures. So eye contact, since the visual sense is dominate for the most of the people, eye contact is an especially important type of nonverbal communication. The way you look at someone can communicate many things, including interest, affection, hostility, or attraction. Eye contact is also important in maintaining the flow of the conversation and guiding the person when they have to answer, right? Touch and physical space is something it can change. For example, like, so how many times have you feel uncomfortable because someone is really close to you? Right, because they are invading their personal space. So this can change between cultures. So I'm Latin, for example, and I, I don't have any problem with the physical space. I like the people to be close to me. This is something that I used to. I like that if I having a hard conversation with someone about my child, maybe they touch my hand, maybe they give me a hug, because that is what I'm used to. But not all the cultures, not all the people have the same response. So there is some people that I like to have, but they feel super uncomfortable if someone is too close to them, or if they like touch them. So we have to be aware of all different nonverbal communication. Your voice is not what you say, it's how you say it. When we speak, other people can read our voices in addition to listening our words. Things they pay attention to include is the timing and the space, how loud you speak, your tone of inflection and sounds that they cover understand. For example, if you are using think on someone's tone of voice, and you can indicate like for sarcasm, anger, affection, or confidence. So we can get a lot also just for the way that we're speaking. So as an example, we're gonna see these pictures and see what information can we get from them. So we can see in this picture if someone is happy. We can have an idea how this person is feeling or what is going on, just looking at the pictures, right? Maybe she feels frustrated. The other one feel like super confident. The other one feel a little bit intimidated and sad. So just looking. So it is important to think in all the concept. Like when we're gonna communicate with someone, is my body is like I'm using the right time to talk with this person. So it's a whole, it's not what I'm saying, that's a whole body expression too. Listen is a really important of communicate. It is as important what we're saying to also hear or listen what the other person is saying. So during the conversation, listen closely, try to make eye contact, nod when appropriate, and be silent when the parent is speaking. After listening, repeat back in your own words to the parent the main point, so he or she will know that you heard and understood. This is a really good activity for for a listening. It's like if I'm gonna give an example. If a mother of a child is saying that her child is not speaking as clearly as his neighbor child of the same age. You might say something like, I hear you're saying that you don't hear Jeannie speaking clearly. So you are listening what she's saying and repeating back in your own words to make sure that you understood and that you hear her. As you listen, also consider how the parent's feelings about what he or she is saying. Watch and listen closely for clues for those feelings. If you acknowledge those feelings into what you say, you will build a strong connection with the parent. For example, if a mother says worry when she talks about their child, you might say, it sounds like you are pretty worried about this. Sometimes parents are not going to let you know, like, oh, I worry. But if you are able to feel that in their words, like listen to the way that they are speaking to you. So maybe you're able to get those feelings and ask the parent. So the parent feel that that compassion is coming from you. So for this part of the training, we're gonna talk about, this part of the training was for the CDC Watch Me Celebrating Milestone. Is an online training with 4 models that it is amazing and it will be an amazing complement to this training. The website is there, but I just want to let you know this is the source where we took this part of the training. So how to communicate with families about development. Parents see you as a trusted parent in the child's care, and they look to you for information about how their child is developing. Using good listening skill can make your conversation with parents easier and help you feel more confident. You are the expert. The parent sometimes is the first child. They comment to you to ask questions. They listen what you're saying. It is important for them what you're saying. So just want to remember that you are the expert, and it will make a big difference the way that we communicate with the parents, right? So difference between developmental monitoring and developmental screening. So developmental monitoring means observing and notifying specific ways of a child's play, learn, speak, acts, and moves every day in an ongoing way. Developmental monitoring often involves tracking a child developmental using a checklist of developmental milestones. Developmental screening is a more formal process that uses a validated screening tool and a specific age to determine if a child developmental is on track or whether he or she needs to be referred for further evaluation. Both developmental monitoring and developmental screening should be done for all children. However, we are going to talk about a little bit more about the developmental milestone. Like what we wanted to know here is like, it doesn't matter if you are using a developmental monitoring or developmental screening, like how you're gonna use the information that you get from those to talk with the parent. That is what we want to say, like what we're gonna use from them to talk with the parent. So please, before to talk with any parent, be aware of, like, make sure you know the center's policies. For example, at A, B, C, D Head Start, we take an interdisciplinary team approach to supporting child development. The full team should discuss concern about the child's suspect development before any communication with the parents or guardian happens. Be aware that the intervention specialist and mental health specialists can support staff and family with appropriate referral information and resources. And let your supervisor know you plan to have this conversation with a parent or guardian. Your supervisor is able to join this conversation. Use the complete milestone checklist as the base of your conversation. So we're saying, so instead of saying something like, I think Jackson is behind in his development, he can do things other children can do at his age. We wanted to say something like, I wanted to take a minute to talk with you about how well Jackson is developing. I like to use a checklist for development milestone. It's a good for helping us to understand his development and which milestone he's met along which ones he's still working on. So if we set up already an expectation with the parents that we are going to be using these milestones, the parent know what is going on. They already have this expectation. So in the future, something is also happening with the child's development, they already know that we are tracking this information. And also you can give it a copy and they can do it at home too. It's always good to start a conversation by highlighting some of the child's strengths. So how different it sounds if we say, Jackson has made some real progress in his development milestone lately. I noticed he really likes to play along other children and he is good at following simple instructions. There are other milestones he's met and some he's still working on. Let's take a look of the list and you can fill me on wherever he's seen some of this at home too. Right? This is like the way that we wanted to start this conversation. Like we're already setting up the parents for like, yeah, we're talking. The parents are happy. Their parents are like hearing all these good things that the kids is able to do. So he doesn't put that chill in front of you. And they are able to listen the rest of the conversation. That is going to get a little bit more difficult. But if we start the conversation with something like, Jack doesn't know what to do with a phone, or even a spoon, and they are no milestone they hasn't met yet either. The list show all the milestones he can do. So we start with something that with the parent is gonna already put that barrier and he's not gonna be able to listen what you are saying next. So always start with the highlights. What is the child doing good? What he likes to do, how happy he is. Like this is a good way to start a conversation, especially one that is gonna be a little bit difficult for the parent. Focus on a specific developmental milestone in your conversation without including any diagnostic label. Even if you believe you can identify a specific disability in a child, it's never your role to take a diagnostic. We are not doctors, so we cannot make any diagnosis. So we can say something like, I saw a special TV last week about autism. I'm pretty sure Jackson has autism. Or like, oh, my cousin was showing exactly the same behaviors and then he got a diagnosis of autism. This is not our role. Our role is only communicate what we are seeing. And like showing what we are like, what the milestone is showing and what we are seeing with him. Does Jackson turn and look at you when you call his name? I have noticed that he does not seem to respond to his name, but continues to play with a truck, spinning the wheels around and around. See, that's different. Like we are telling the parent what we can observe, what we are seeing about his behavior. We're not making any assumptions. Be clear about what your goal is for the conversation. Be honest, kind, and respectful in your tone. It is okay to say you may be overly concerned, and that is always best to check with the child's doctor. Look at all these milestones Jack is missing on this checklist. That means that something is really wrong with his development. He's way behind the other kids in his room. If I hear this from my son teacher, I will be like devastated. I will be like, what is wrong? What is wrong with my kid, right? Like, what happened? So we have to use that compassion. We don't want to say something like that is gonna destroy the parents' feeling. This checklist can help us to better understand Jackson's development, and that's what we are trying to do. But he's missing some of those milestones. That doesn't necessarily mean anything is wrong. It's always a good idea to pay attention to his development and talk about it when you take him to the doctor. I will give you a copy of his milestone so you can take it with you and talk with your doctor next time you go. We also want to make sure, like, sometimes maybe the child has a little delay and only need a little bit push to get caught up with their peers. So it is important to have that conversation too with the parent, like, we just wanted that you pay attention to this. This is a little concerning, but maybe not a big deal, but we just wanted to keep you in the loop to what is going on with your child. Make sure the conversation is a two-way discussion. Pause a lot, giving the parent time to think and respond. Remember your active listening skills. Listen and watch the parent to decide how to proceed. Pay attention to your tone of voice and body language. So, have you seen Jackson to do some of these milestones at home? Give a pause. Now we will look at the checklist. What are your thoughts? What do you think is a good idea to do next, right? We also wanted to make sure the parents had the opportunity to talk and like let us know what they're thinking, their concern. It could be that the parent already was thinking about this at home and it's a relief to know that someone else has noticed it. Or maybe this is something that is completely new for the parent. So we have to see how the parent is reacting to the information that we are giving to them and see how we're going to proceed. Remind the parent that you care for the child and you want to make sure that the child has every opportunity to be his or her very best. So once I was having a conversation with a parent and the parent told me that the teacher say like, in my 25 years of teaching, I never had a kid like your kid. After hearing this from the teacher, how is gonna be that parent trust? It's gonna be ruined. Like they already know, like this person is my son is like get to failure, right? This person doesn't interest about my child, or maybe she does, but wasn't a really good way to communicate with the parent. So the parent, the only thing that they can think is like, oh, you don't care about my child, or you already give up on him, right? So we wanted to be really aware of what we're saying and make sure that the parent know that what we are saying, it also comes from love. Like, I really love Jackson and I'm so happy to have him in my class. I want what is best for him and why I wanted to talk about this with you. If we do have a concern, it's best to address it right away. We can talk about this again in a month or so, and maybe then you can let us know what the doctor thoughts were. So we are starting that conversation already, letting know the parent, like, we love him, we're happy, we're not telling them like, okay, Jackson is challenging. He's not just like the other kids, but I'm doing what I can. Like, we're already setting up that expectation for the parent to like bring that guard up. So what are the key points? First, the schools help the development with the family regularly. as already like set up those expectations that we're gonna talk about development. Give them some of the milestone. When you talk with families, be mindful of cultural differences. Remember all those like nonverbal communication, other factors that it can influence in the conversation. Good listening skill help make a conversation more successful. Repeat in your own word what the parent is saying. Give the parent the opportunity to respond and also really listen what they're saying. Try to get those feelings, even if the parent are not really expressing with words, but just try to like breathe under what they are saying. Encourage families to use developmental milestone checklists to monitor their children's development. As I say, like maybe you can give them a copy of the developmental milestones. So also parents can be doing the same, especially if parents are like in that deny process, like just give them a copy and ask them to do their own observation at home. Before raising concern with families, make sure you're well prepared. Make sure you have all those lists and indicators that is showing. And when we're talking about being well prepared, it's also emotional prepared to having this difficult conversation. Sometimes talking with parents can be draining. So make sure that your body is prepared, your body language is prepared, your mind is prepared, that also you are having that time to talk with them, that they are not in a rush, that you're not in a rush, that you're having that specific moment and time during the day that you're gonna really be able to sit and have that conversation with the parent, and the parent is gonna be there like mentally present, and you're gonna be there too. Like it's not like, oh, he's gonna come to pick it up and to just have those 5-minute conversation when the parent is not even like mentally there. So make sure to you prepare this time to talk with the parent too. And encourage the parent to talk with the child's doctor or healthcare provider. That is also a really important like part, like just provide with parents with information about what is gonna be the next steps. Depending if like it's the 0 to 3 years old, maybe they can be enrolled in early intervention, or if like 3 and up, they can do an evaluation for the school district. But also part of be prepared is also bring those next steps, so the parent not only receive what is the concern, but also what is what they can do about this. Thank you so much, and I hope you have a great day.